So as I'm reading this book, 5 years later, I say, or what, however many years it was, I reading it and I said, wow, that sounds sort of like my doctor, who I love. And so it was like just the perfect perspective for me to fall in love with this model. One of the things, that I love about this model is, as a student and then again as an emergency medicine clinician, even as an emergency medicine clinician, which is like a professional, real job, I didn't have PTO. I didn't have um, the ability to just take off, 3 hours in the morning to go to the doctor. So if I had something like an infection, or I needed to see the doctor for some reason. I had to miss 12 hours of work. And it's not just 12 hours of work. I mean, it's like any job where you work shift work. It's, well, if I call out, I now have to like find someone to cover me. I have
I see, yeah.
breath on my team. I lose, a day and a half, 12 hours of pay. One of, maybe 3 or 4 shifts that I'm working that week. Like it's a big deal. And but because I had direct primary care and insurance wasn't involved, I could just call my doctor's office and say, "This is what's going on. I don't know if it's appropriate, but like, do you need to see me? Is it possible for you to treat me for this over the phone? Can it wait till tomorrow?" And I could have those conversations on the phone or via telemedicine. And there was no pressure on me to go in because they're able to spend a half hour having that conversation before I go on shift rather than having to, being essentially forced to ask me to come in because they need to be paid because they need to pay their staff and need to, keep the lights on. And so, direct primary care has a lot of advantages, I think, for patients that allow the doctor or the clinician to act in the patient's best interest, right? If they thought I needed to come in, they would have had me come in because clinically that made sense. But it gives options to make care more convenient and to make care accessible, and at least in my opinion, at a much cheaper price point than even paying your deductible.